the COVID-19 vaccine has been approved for kids age 5 to 11. As clinics and hospitals around the metro are preparing to distribute the vaccine, we know you at home, you parents, have questions. So joining us this morning is Dr. Nathan Boonstra. Dr. Boonstra, thank you so much for being with us. So let's talk about some of those pediatric doses of the COVID vaccine that are now at Blank Children's Hospital. They are in the hands of doctors, of pharmacists. But what's that process look like to get these kids vaccinated?
Yeah, first I'll say that pediatricians across the state and across the country are very excited about this. We know that COVID is hard on kids, and we know that this is a fantastic way and an easy way that we're going to be able to help keep kids safe. The data on the safety and the efficacy of these vaccines looks fantastic. I would caution it's going to take a little bit of time before some pediatric clinics are ready to be able to give the vaccine. Not for lack of trying, it's just that now that the vaccine has been approved by CDC, it is ready. We need a little. Sometimes we need a little bit of time for training, and some of that stuff didn't really become accessible until just recently. Clinics are just getting their stock in, and there's training of staff to be able to give the vaccine and whatnot. So it's worth giving your doctor's office a call so that you can figure out what their process is. But please be understanding of the fact that it might take a couple of days for some clinics to be able to actually put vaccines into arms.
Okay, and because this is different, these vaccines that these kids are getting, the dosage is different than what adults got. So talk to me about that, and talk to me about what side effects that might still have on kids.
Sure, it is a smaller dose. It's essentially the same vaccine with a smaller dose, and that's one reason why this process takes a little bit longer. In that we're not going to be giving smaller doses of the previous vials. We're going to be giving our doses out of the new vials that we're receiving right now, basically. As far as the side effect profile, it looks very similar to what we've seen in other age groups, which is to say that it can make somebody feel a little crummy for a day, but it's far less, it's far better than getting COVID, which can make you seriously ill. Seriously ill,
and that long COVID we're seeing in young kids can be dramatic when we don't know how long it'll last.
Yeah, we're seeing, it's worth pointing out that over the course of this pandemic, there's been about 700 or more kids who passed away from this illness. We are seeing kids with long COVID, a large percentage that go on to have symptoms a month or longer. We're also seeing kids with this MIS-C, which is a multi-system inflammatory disorder that causes inflammation in different organs. And we know that that's not healthy for kids either. So there's a lot to protect kids against. It's absolutely worth doing. We would protect kids against other illnesses, and we have been immunizing against other illnesses that are, present the same kind of danger to kids. And this is no different. We really do want to protect kids against this illness.
Dr. Boonstra, thank you so much for being with us this morning. We understand how early it is. Again, we just want to bring the experts to people at home to be the most informed that they can to make the decisions best for their families. We appreciate your time.
Thank you.